Good morning, everyone. I just want to quick open it up and then I will turn it right back over to Jill. I am Julie with Inspire Sheboygan County. Thank you so much for joining us today. If you had a chance to see my email, we had a slight change. Our labor and delivery nurse is unavailable, hopefully in a labor and delivery. And we have a pinch hitter who is going to explain to you the career of nursing and a lot of careers in healthcare. If you have questions about any of them, we're going to go ahead. I'm going to turn it over to Jill from New AHAC.
So hello, everyone. My name is Jill Nimchak, and I work for the Northeast Wisconsin Area Health Education Center, or what we like to say is New AHAC. So the Area Health Education Center, we are a liaison, a middleman between academic institutions and healthcare facilities. So we are throughout the entire state of Wisconsin. So we really do work with all academic institutions and all healthcare facilities all over the state of Wisconsin. So I get really excited when I get to talk to students because here in Wisconsin, we have amazing academic institutions that really cover a lot, many health profession careers. So if you are truly interested in going into healthcare, please stay in Wisconsin and go to school because we have about 97% of the programs that are offered in healthcare situations. So today I am pinch hitting, and one of the reasons why I am here is because our agency, probably 10 years ago, was working a lot with healthcare facilities and academic institutions, including high schools. And what happened was many of you want speakers, just like we were supposed to have today. And things happen, right? So healthcare happens, and it happens kind of at a moment's notice. So what we did was we actually created a 19-unit curriculum to take the burden off of some of our healthcare professionals when teachers wanted professionals in schools. So we, back before, when they used to let us come into schools, we would go to schools much like any of yours, and we would do in-house kind of presentations, and we would bring fun stuff for you guys to try out. Well, COVID certainly has changed that a little bit. So then we worked with Inspire to create these virtual opportunities. I am not a nurse. However, we have worked with many nurses and created these curriculum units. And so I do have a lot of information in regards to nursing. I can't speak kind of to the hands-on performances of those kinds of things, but I can answer a lot of questions in regards to what nurses do on a daily basis, what kind of schooling that you need, along with nursing, but any other professions. So I know we kind of have a classroom of folks here, so I'm happy to do that. But what I would like to do, if it is possible, is take any of your questions or comments you have about nursing. I can talk a little bit about it, but if you guys have any questions right off the bat, I'm happy to answer any of those right away.
And Jill, maybe to give them a few minutes to think about that, I want to start with, we, through Inspire, hear a lot of the questions from students. And always the question is, well, I hear there's a 2-year path to nursing, and I hear there's a 4-year path to nursing, but yet I've heard it's the same, but different. So can you explain a little bit about that, the differences, benefits, that kind of thing?
Yeah, absolutely. So here in the state of Wisconsin, and it is not like this everywhere, there are some other paths in other states where it's a little different. But here in the state of Wisconsin, we knew that many years ago, we knew that we needed nurses quickly. So hence what they call the associate degreed nurse, or ADN degreed nurse, was created. And the ADN degreed nurse, which is the associate degree in nursing, is created at a technical college. You can only get that degree at a technical college. You cannot go to, say, like a UW Oshkosh Fond du Lac to get that, or a UW Green Bay Sheboygan to get that. You have to go to a technical college. And what that means is your very first year that you enroll, all right, you do take a few general education classes to make sure that you're ready, but you really get the clinical training to be a nurse. You don't often take the theory related courses. So say year one, you are taking pharmacology, you are taking phlebotomy, you are taking all of the kind of entry-level classes to become a licensed practical nurse. So your first year at the technical school, you will take courses where you can then finish the year and take the test for the licensed practical nursing degree or the LPN degree. Now, say, I'm going to pick on some names on the screen here. So let's say Candace and I both want to go to school to be nurses. Okay. So Candace chooses the fact that she's like, you know what? I don't know what I want to do. I think I want to go into nursing. And so she chooses to go to a technical school. And I'm like, hey, I want to go to college. I want to get the full college experience. I'm going to go to UWXYZ. All right. Number one, make sure that UWXYZ school has a school of nursing, to make sure that it has a nursing program. We have many nursing schools here in the state of Wisconsin, but some do not. So make sure that there is a nursing program at the UW school or the private school that you want to attend. Same with Candace. Make sure that your technical school has a nursing program. So Candace enrolls day one, okay, into her nursing classes. Day one for me, I am a freshman at UW school. All right. I have to take a minimum, I have to take 2 years of usually general education classes. So the classes very much like you take when you are in high school: literature, math, science, anatomy, all of those kind of general education courses. You often have to take a music class. You need to take a health, like Phy-Ed type of class. I spend 2 years at school doing that. While Candace at her first year is really kind of taking those entry-level nursing school classes. So then year two for Candace, she is starting to take her registered nursing classes. She will also go out in that first year and do a few clinicals. So that's where you get to go and do some hands-on patient care. You practice the skills that you are doing in class. So it may be the week that you are doing vital signs. So you spend time at a healthcare facility taking vital signs. So every 15 minutes you go in and you are with these couple of patients, and you've got teachers that are there to help make sure you're doing it right, make sure you're recording everything right, make sure you're documenting everything right. So for me, I'm at school and I'm finishing up my general education classes. Now I need to have a certain grade point average to apply to the nursing program. So I want to do that kind of at the beginning to the middle of my sophomore year, right? I want to be applying to get into the nursing program in my junior year of college. All right. Good for me. I have a great grade point average. Grade point average is different getting into that UW school as opposed to getting into that nursing program. It's usually many points higher. So sometimes it's good that you need a 2.5 to get into UW Oshkosh, which is fine, but you might need a 3.75 to get into the nursing program. And now that's looking at your college classes. So you need to still do well in those general education classes that I sometimes consider aren't as fun, but very important. Okay. So then now Candace is in her second year of nursing, and I am just applying to my nursing program. So literally Candace is going to be done with her nursing program before I have started mine, if we started at the same time. All right. So what Candace will do is once she finishes her second year, she will actually sit for the NCLEX exam. That is the RN registered nursing exam. So she will sign up for that. You have to pay for that. That's an additional cost. But once she passes that exam, and she's going to do great, she's going to pass it, she gets those RN initials behind her name, and she can then go out and apply for jobs. She is, however, listed as an associate degree RN, but she still is an RN. So now let's say I get into my program my junior year, and I spend my senior year in nursing school. Phenomenal. I graduate. I also sit for the NCLEX exam, and I pass. I get those RN initials behind my name as well. All right. So now I am considered a bachelor's degree nurse, so a BSN. All right. And really what that means is that when I go and apply for a job, as opposed to Candace, It just means I have some of the theory and some of the background information about nursing and about just working in a managerial kind of position. I have maybe some leadership experience, and that's really kind of what the big difference is. Now, you may hear people say that some organizations are moving to, only hiring bachelor's degree nurses. Well, that's not really true. We are moving to the spot where we do want associate degree nurses to kind of finish and get a bachelor's degree, and they're kind of calling that a bachelor's degree in 10 or in 5. They have not really decided that yet. But what's really great for Candace is many of her workplaces will pay for her to go back to school. So she can take classes, and as long as she gets good grades, they will reimburse her. They don't pay you directly. You have to pay the money. And then based on the grade that you get, all right, they reimburse you to take those kind of classes and to finish up, which is great because now, guess what? I get a job and all they're doing is paying my salary. They're not paying my, loan payments for me. So there are some things to both. As starting out as an RN, a 2-year degree RN and a 4-year degree RN will legitimately get paid the same. If we start on the same days, we will get that same starting salary. All right, same. And typically nurses are paid an hourly. They're not usually paid a salary. And a salary, what's the differences between salary and hourly is hourly, you get paid by the hour. So if I work 10 hours, I get paid for all 10 of those hours. A salaried employee, you are given a set of hours, usually 40, and you are paid yearly. You are paid a yearly salary based on that time. So it doesn't matter if I work 50 hours or if I work 39 hours or I work 70 hours or if I work 40 hours, I get the same pay literally every couple of weeks. Okay, so that's kind of the bigger difference. So I don't get, as a salaried employee, I don't get what's called overtime. Nurses can work overtime, which is why it's great for them to be an hourly person. Now, typically nurses that are in managerial type positions are paid in a salary situation. Nurses that are doing any kind of direct patient care, those people are doing work on an hourly basis.
Has the process of clinicals changed at all since the past year?
Yes, absolutely. Many healthcare professionals, well, when kind of the pandemic hit, we are so super fortunate right now that we know that we need to continue to train healthcare workers because clearly we've realized that, right? You've seen in the last year that we are burning people out, burning both ends of the candlestick, have you. They realized at first they stopped doing all kinds of clinicals. And what happened at that point is many schools got very creative and they were doing things with simulation. So mocked up things, but not so much like you can think of like video game related, but some of them, many healthcare, well, all healthcare academic institutions have like what they call patient simulators. So they're like big mannequins that can do things. And many of them are very lifelike and they can do a lot of things. Like they can speak, you can draw blood from them, they can vomit, they have pulses, they can breathe, they can turn blue. So what many schools did was they kind of went to simulation items. They even have simulators that can give birth. So, which is really kind of talking about labor and delivery. This mother can give birth 12 times a day, where you wouldn't have that happen in a healthcare setting, right? Wouldn't have one woman giving birth, but if you were in a really busy labor and delivery place, you might have multiples. So they went to doing many simulations until they could get back in to healthcare settings. We are very fortunate that it didn't take long, and many of our healthcare facilities did bring students back in, not as many. So you may have whatever the classroom is that you're sitting in right now, it may have been half of that. So imagine thinking, hey, I want to graduate and I need to get these, they have to have a certain number of hours with types of skills. In order to do that, that's how they graduate. So we've been very lucky here. And I will say also in the Milwaukee area, they have been letting students back in, working again, following all of the necessary protocols. But I do work a lot with some students, health profession students, so nursing students, medical students they're at children's. So, they are places. So they are getting their clinical hours, but it did change a little bit for a while.
Yeah. Would you say that a great way though to help precede that clinical experience would be to start off as a CNA?
1000%. So even just to give you again an example, so again, you go back to Candace and I going into school, right? So you don't really get any hands-on patient contact until you see your first patient. And how scary is that if that is your very first exposure to a patient? If you can become a certified nursing assistant, that is the most brilliant thing you can do for yourself. Number one, to know if you're going to like healthcare, to know if you can kind of handle those kinds of things. Nursing in particular, you deal with things that are coming out of people, and again, lots of folks, and when we talk about labor and delivery specifically, well, people do not go and stay at healthcare places. So people who are well and good, including babies and mothers, labor and delivery, you're talking a max of 3 days that woman and that baby are in the hospital, a max. If you are doing well, they'll get you out early. Right? It's costly to be in a hospital. So you have to know that you can take care of sick people. Healthcare, and let me ask some of you, and I am one, how nice are you? Oh, let me just ask it this way, because I'm going to make you guys participate, those of you that I can see. Hands, how many of you are really good and kind when you are sick? Right? None of us are like super nice when we do not feel good or in pain. So we are not always dealing with people who are super happy to be in a hospital. They're scared. They don't really know what's going on. You need to be able to know. So if you can be a CNA, that's great. And I will tell you this, the note that my coworker just shared with me, which is bottoms up. Most healthcare or nursing programs in the state of Wisconsin require that you're a CNA before even applying to nursing school. So if I went into a 4-year program and I didn't have my CNA yet and they were looking at my application, they'd be like, trash. There's no reason. It's a great thing to do, especially if you want to go into nursing. And again, what is also great is Wisconsin has created a youth apprentice program or a youth options program. Talk to your school teachers where you can get your CNA through your high school. And guess what? They will pay for it. All right. So it's kind of a no-brainer to do that.
What are the limitations between the associate degree nursing credentials versus the bachelor degree nursing credentials? Are they able to do the same tasks once they're able to work in the field?
There are some limitations. So a higher level management position, you will need to have a bachelor's degree. Some of the higher level specialty opportunities, you will need to have a bachelor's degree. That doesn't mean you can't work your way into that. Sometimes and I'm going to pick on Candace again. If you are a Candace and you're an amazing worker and you've been working, maybe, they were like, hey, we need somebody to, we're short on surgical nurses, and Candace, we just think that you do a great job. We want to start to train you in this. We know that you don't have a bachelor's degree, but we think you'd be amazing. Candace has done this for 3 or 4 or 5 years. She's great. They may move her up into other positions as opposed to someone who just has their bachelor's degree and they're new. Okay. They may really ask you, Candace, like, hey, would you consider, we'll pay for you. We'll work it into your schedule. We'll pay for you to go to school. We'll maybe keep you at some hours, but we'll work within your time frame because we really think you're great at this. Kind of starting out when you were first getting out, kind of, again, those management positions and those higher specialty level positions, like working in trauma, working in high level ER spots, working in a cardiac cath lab. They are going to want folks to have that bachelor's degree, but that doesn't mean that you can't work into that or work for that.
How many hours a week do nurses typically work?
That is up to you. Because nurses are typically, again, hourly. If you are a salaried nurse, you typically have kind of an administrative position or some sort of things. It will be a minimum of 40 hours. Okay, 40 hours is considered a full-time position, right? So that's what they would base your full-time salary on. Now, nurses have kind of cool opportunities. If you want to work 70 hours a week, you can work 70 hours a week. That's up to you. There are situations where nurses work, Brenda, correct me, it's like 3/12s, and that's considered full-time? Or is it?
Yes.
Yeah, so you can 3 12-hour days or nights, and then you're considered full-time. Or there are weekend programs where you only work weekends. I know in Milwaukee, there are some facilities that you're on 7 days a week, and then you're off 7 or 8 days, and then you're back on for 7 days. And those are typically 12-hour shifts. So it gets long, but then you have 7 days off in a row. Right? That's kind of cool. There are all sorts of really great opportunities that nurses can do. They can work casual, which a casual position is we'll call you if we need you. So if you have an opportunity that maybe you don't have to work and you can just work for fun or work for spending money, that's an opportunity as well. You can work part-time, which is 20 hours. There are some jobs that you can do like 24 hours and they'll consider that full-time, and you can get benefits because benefits include health insurance. And that's something you'll want to know about when you get older because you'll need health insurance and the cost of health insurance. So there are many, many different types of hourly opportunities nurses can have.
Great answer. Thank you. What personality characteristics are important for nursing?
Yeah, so you need to be kind, caring, compassionate, pretty detail oriented, right? You need to be empathetic.
Could you explain detail oriented?
Oh,
yeah. That looks different in nursing versus something
yes.
else.
So in nursing, you are going to be taking care of several patients at one time. So you need to make sure that when I say detail oriented, that you are with that patient and remembering everything that needs to be done with that one particular patient, because you're going to have 6 to 7 other patients that are going to need totally different things. So as a nurse, your job, and I don't like saying this, but your job is to follow orders. If you don't like taking orders from others, you become a nurse. All right. That is your primary job. So whether it's a physician assistant, it's a doctor, or a nurse practitioner, they give the orders. Those people, even on top of that, athletic trainers, physical therapists, occupational therapists, speech language pathologists also write orders. So it's your job as a nurse to follow the orders. So your patient could be, hey, every 15 minutes, you need to do vital signs on this patient, and the patient across the room, it's every 30 minutes. This patient, you have to get up and rotate them, or you need to flip them, or you need to provide some sort of care. They need to be toileted, or whatever the case may be. That is your job as the nurse. You also need to monitor them. You need to visually look at this patient every time you are with them to see if there are things going on. Do they look puffy? Do they look white? Do they look gray? Do they look blue? What kinds of things are they saying? Are they alert? Are they not alert? There are many different things just based on observation, and everything that you need to do, you also have to record that. So what lots of people don't like to talk about is they don't really call it paperwork anymore because everything's recorded electronically, but everything that you do with a patient also has to be documented.
Yeah, that's awesome.
Detail.
As you're talking, it reminds me of waitressing.
Yes,
maybe
yes. Another really great skill is remembering all of the things that you have to do.
Yeah. So being a waiter or waitress, a server somewhere might be a good way to start training your mind to remember like tables, what they want and what they need. And then
yes. And multitasking, because you, at a minimum, like a medical surgical nurse, which is where they kind of start out everyone. That's your very kind of entry level position. In that medical surgical, they call it med surge. So if you want to be in the know, that's what it is. Like I work on the med surge unit. That's kind of where everyone who is in the hospital that doesn't have a major issue will go. And you're taking care of every kind of thing there. And so really that multitasking of remembering who needs what and how it all works, being a pretty good time management person will also help in being pretty organized. But you'll learn that stuff too. So don't let that throw you off if that's not your thing, because those are skills that you'll be taught in nursing school. Like, again, day one, they don't throw you in and be like, all right, you're a nurse. They teach you these things in school.
Yeah. Somebody wants to know, are there any extra credentials you need to become a traveling nurse versus a stationary nurse?
Yeah, traveling nurses are cool. You would need to have a bachelor's degree to be a traveling nurse. But other than that, they kind of want you to have some experience. So it wouldn't be like your very first job out of school. They want you to have some of that medical surgical experience. They may want you to have some ER experience, depending on where they're going to put you. What's cool about traveling nursing, and especially right now, it's very popular. It's kind of cool because they kind of have to pay for you to go there. So they will get you to where you need to go. They provide you housing and they pay you a salary. So, and it may be a short-term position. So it may be like, hey, we need someone for 3 months, or it may be we need someone for a year and a half. Okay. And then you kind of sign that contract and agree to do that. And usually you work through kind of another party. So you would sign on with a company to be a traveling nurse.
Yeah, it's a great way to
You
see the
need to
country.
Yeah, you do need to be pretty outgoing. You need to be, a really, really good communicator in order to be a traveling nurse, because think about it. It would almost be like if you had to start a new school every time. So, I mean, think about that where, every 3 months or whatever you sign the contract for, you're going into a new building, you're meeting all new people. You don't know where the supplies are. You don't know where the bathrooms are. You don't know where the cafeteria is. So you need to be really good at being adaptable and asking really good questions.
Yeah. And just so we have it right, because sometimes I think traveling nurse, some people get mixed up with in-home nursing care, because there is that kind of traveling nurse as well.
Yeah, so like a visiting nurse, which is a visiting nurse, the Visiting Nurses Association, that is a registered nurse. And again, they prefer to have kind of bachelor level degree nurses, where you would actually have a group of clients or patients and you go into their homes and you help them with nursing cares that they need. When we're talking about labor and delivery, when my daughter was young, she had some health issues and we had a visiting nurse come in, and very reassuring because she actually had a port in her chest that went right to her heart, and we had to flush it daily. So they had to kind of teach me how to do those things. And it was nice to have a nurse there to show you what you needed to do and how you need to do it. But when I found out she wasn't coming back every day, that was a little disturbing. She was like, no, I'm here to teach you how to do this. But there are nurses that do that, where they may just have a small region. There's also home health care aides that also do that, where they're more like a CNA. And they travel to people's homes and they have a list of clients that they take care of daily or weekly. That's on the certified nursing assistant kind of thing. And you need to for sure be 18 and be very responsible, and before you can kind of get gigs like that.
Yeah. I'm going to jump ahead 2 questions because we're kind of talking about different types of nursing and specialty nursing. And there was a question that came in. Do you have to know what specialty of nursing you want to be in right away, or can you figure that out during clinicals?
I think you do yourself a disservice, in my opinion. I work a lot with nursing students, but I specifically work a lot with medical school students. And they sometimes, more often than not, what I hear is high school students who will say, I want to be an XYZ doctor. Every medical student that I talk to after they've done a few clinical rotations is like, I don't know what kind of medical doctor I would be. So it's always very interesting to me. There are a rare few that know, but many of them, it is based on, you have to try things, right? I mean, think about when you were a freshman in high school to as opposed to if you are now a junior or senior. All of the things that you've learned or saw or realized that you were good at or tried, your tastes change a little bit, even in music, right? So it's like you liked this when you were 8, but now you totally don't like that kind of music anymore. So I would go in with a very open mind, no kind of like, hey, try out some different things. Lots of people think that they want to work with babies and pregnant women. We're talking about labor and delivery today. But again, realize that well babies and well women go home. We don't end up taking care of the well women and the well babies. What we end up taking care of are the very sick mothers and the very sick babies. And if that tugs on your heartstrings, maybe not the best career opportunity for you. Not that you can't be sympathetic and empathetic, because definitely that's a good quality, but you can't be crying, as you're taking care of a woman who's going to lose a baby. Not great. So try as many things as you can. That's why it typically is nurses have to do clinicals in certain rotations. They make you kind of do that. You don't just get to say, I'm only working with kids.
Great. Do you expect the in-person job shadowing to open back up in the healthcare industry within the next year? Or what do you feel the outlook for the industry is?
We just met with a group of, I'm on some of the alliances, the healthcare alliances, and we just met with some of them more in the southern region. And I'm going to be brutally honest with the folks that are here, that them seeing the way that people were able to do things virtually and not having people in their building has been a huge bonus for them. I think they may milk this for as long as they can to not have students in their facility. It is always great. It's always great to see things in person. However, my advice, become a CNA, right? That is a way for you to get to see and be part of healthcare. And if you can't do that or don't want to, another option is an EMT, an emergency medical technician, right? You can start doing that when you are 17 years old. You have to be able to work when you're 18, but that's another option if you don't feel like you want to be a CNA. The other option that any of you can do is you can volunteer at a healthcare facility. Right? That is an excellent way to show that you are responsible, respectful, and that you want to learn more about healthcare. If you can show up to a volunteer position, you show up on time, you're professionally dressed, you treat people well, you're nice, you're kind, you learn the building, you can transport patients wherever, and you start to talk to people and tell them you're interested in healthcare, I guarantee they will take you under your wing. You will get to see things that any job shadowing student will never get to see. They will start to look for you and they will say, oh, Alyssa's here. And you know what? We're doing something really cool up on the 5th floor and I want her to see what's happening. So I'm going to go grab her. So if you can volunteer, that's going to be your best bet. And it really doesn't matter. It can be at a clinic. It can be at a hospital. It can be at a community healthcare organization. There are plenty of those in every area where all of you are working or going to school.
Yeah. And off of that, she said, if that is their decision, do you think they would up their virtual game and allow students to actually see more than just Q&A?
Yeah. Just quick show of hands for those of you that are here. How many of you have had an appointment with a doctor? All right. So the problem with that is we need to get your permission if we have a classroom come in. How many of you want a group of people in the next doctor's appointment you have? Show of hands. You. All right, I need your name and email because the next appointment you have, we'll get it set up. No, so again, as you get a little bit older, you guys don't necessarily, but I have a 12-year-old that when she goes in to see her pediatrician, she is asked to get undressed. So not many people want other people, not many patients want folks to be like, hey, we're watching what's going on here. That is the biggest issue that we have with healthcare, in person or virtual, is patient confidentiality. No one wants to be like, oh, I see so-and-so. I know them, right? No one really wants to have that happen. It would be embarrassing. It would be detrimental. I mean, think of all of those things that whatever you're talking about that day, and maybe it's not that big of a deal to you, but to you, it's not. It might be to the person who's sitting next to you, or I'm not going to ask a question because now there's 30 people, viewing. It just becomes difficult because there's a person involved and someone's mom, dad, sister, brother, daughter, whatever, grandmother. And so that's the hard thing with healthcare, is that there are patients involved, right?
Yeah. So Chastity wants to know, are you allowed to pick what you want to do as a CNA, such as a pediatric CNA?
When you take the class, you take the CNA class, you learn, they're generic things that you learn. I am not hugely familiar with a pediatric CNA. Typically, that may occur at a children's hospital type thing, but I'm guessing they don't have very many of those. They would probably have what's called a medical assistant. A medical assistant does have to have a CNA degree, and then it's a 1-year degree after they get their CNA. They're like a level between kind of a nurse and a CNA. They can do a few more things. They can give injections, but I am not familiar with a pediatric CNA because what CNAs do are help with daily living type skills. And you see those more on the geriatric end, which is opposite of pediatrics. It's the older end, but certainly like a children's hospital, even in Nina, may have some of those things, but I'm more familiar with having either a medical assistant or a nursing.
And I know just from a personal family experience, we had someone go into nursing, again, started as a CNA, but went to work at a hospital. And when she started, she asked if she could be on the pediatric floor. And they said, no, we need help here. Here's where you'll start. We'll try and get you to where you want to go, but you don't always get your first choice.
Yeah. And being new that you know, first day, first time, yeah, they're definitely going to use you. And CNAs more are on that geriatric end. They're going to use you where they need you. Thank you, Julie. That's perfect.
Yeah. And based on the CNA, we had another question. As a CNA, what makes you a more desirable candidate to be in a hospital setting versus a nursing home setting?
That's a really great question. Imagine it, you know, if you are, regardless, we're going to say that you're a hardworking person, you're going to show up on time, you're going to, you know, be available for the shifts that you're going to do. It's going to be when you're available and what they need. Hospital CNAs that's a tough position. Typically, hospital CNAs, they like you to be 18. That's not always the case because they've got these, what they are called Hoyer lifts, or a lift that would take a patient out of their bed and transfer them to a chair or a wheelchair. There was a law passed, now it's probably several years ago now, that said you needed to be 18 to work that lift. There must have been something that happened with someone who was 16, and that was a law that quickly changed. And so now you can't run that lift if you are 16 or 17, you have to be 18. So they will often take a 16 or 17-year-old and pair them with a couple of people on the floors that are 18. So in case that happens, but it's going to be when you can work and when they need the availability. And again, beyond the things of showing up on time, being respectful, you know, getting your work done, working hard. If you can display those skills and you can find out, like, what are you looking for? What hours are you looking for? There's no reason why you can't be that great candidate.
Yeah, we have a great last question to end on. But before we get to that, I just want to ask, because I know I've been in the hospital a lot lately, not for me personally, but with family members. Okay. And I've seen, which is exciting, many more males nurses. And I've heard different comments, all good. But what can you comment on the male versus female thing or anything?
Yeah, it really has to do with your personality. So nursing is a caring-based profession, right? You need, again, you go back to those qualities. You need to be kind, caring, compassionate, empathetic, sympathetic, and you need to be able to care for people. You are providing care, and it really is hands-on direct care. It's not care from back here where I'm telling someone what to do. It's the actual, I am providing you the care. Nursing is an amazing profession. It pays extremely well. I didn't talk about that, but I'm going to throw that out right now. The hourly wage for a going nurse right now, Brenda, correct me if I'm wrong over here, is it about $25 an hour, or is it more than that now? Hourly wage for nursing?
No, it usually it's up. It's about between $28 and $30.
$28 and $30 an hour, folks. It went up.
Wow.
And that's an hour. So again, think about if you want to work holidays, they will give you time and a half or sometimes double time. So if you don't care if you work on 4th of July, or you don't care that you work on Labor Day, those are great ways to do that. So $28 to $30 an hour is a great wage. It's really hard to get that in other professions. And so it's a great thing to do. And again, you can choose, like, hey, do I want to go to college or university, or do I want to go to technical school and then maybe think about getting my bachelor's degree? I mean, if you really like taking care of people, it's a great profession. And I'm not even a nurse. They are now also offering sign-on bonuses. And I truly, if we've been in the last 10 years, they've been talking about like having a nursing shortage. And in 2008, we went through kind of a recession, which means the stock market wasn't great. And so people held on to their jobs a little bit longer. I do think the pandemic changed that for many people. I think we're going to see quite a few more healthcare workers leaving their positions, whether it's via burnout or they're just ready to retire and realize life's too short. I think we're going to need many more nurses come in the next 2 to 5 years. I think our trend is we're going to be in, and I think personally, a world of hurt. So
yeah. Okay, last question, I think. Why don't we kind of end on this note? What advice do you have for someone considering this career in high school and beyond?
Well, again, I'm not a nurse, but nursing is an amazing profession. Another thing that's cool about nursing is if you want to change the specialty that you're working in, you don't have to go back to school. So if you are a doctor who's trained in family practice, you actually have to go back to and do a different residency if you want to go into emergency medicine. You have to go back for a 3-year residency to change that. In nursing, if you're like, hey, I want to work with pediatrics, and then after that you're like, ooh, you know what, I'm tired of kids spitting on me and drooling on me and biting me, whatever, I'm going to go to the emergency room. You can do that without having to go back to school. You may need some additional training, right? You may need to do some like shadowing of a professional that's there. But if you work in the ER and then you're like, this is great, I want to do ICU nursing, you can do that. And then you're like there and you're like, hey, I want to do cardiac catheterizations. You can move around. You can move around and do a ton of different types of nursing specialties with one degree.
Yeah, that's awesome.
You can go on and there's masters of nursing where you can go on and get your masters of nursing, an MSN, a master's in science and nursing. You can get a PhD if you would like. What the other great thing about is if you want, once you're an RN, you can become a midwife. That's a person who delivers babies, or you can become a nurse practitioner. And a nurse practitioner beyond a nursing degree is 2 years. And that, again, that nurse practitioner, remember we talked about the people who get to boss people around? That's those people.
Awesome. Well, I don't think we have any other questions because no more have come in. Jill, thank you so much for your time. Thank you for sharing all of that. Students, we apologize we could not get our nurse on today. My goal is to get her back sometime before the end of the school year. So watch the registration page for that, and I will email all of you as well if we do get her rescheduled. I just appreciate your questions and your interest in what we're doing, and thank you so much for being here. That's what
so Julie, I'm going to type my email into the chat box, and then for any of those of you that want to ask more questions or whatever, don't hesitate. This is my coworker Brenda was sitting here feeding me some information. This is our job. We are super passionate about students that want to go into healthcare. We do run AHAC runs some other types of programs. I will tell you, we used to run summer camps. We are no longer doing those things, just again, COVID related and kind of patient care related, but we do have other things that are going on. So don't hesitate. It's helpful to me if you say, this is who you are, like, oh, you talk to our group, then I at least have some little context of why you're emailing. So
yeah, that's awesome. Thank you for sharing that. So again, students, thank you for being here. Thank you for your questions. Thank you for your participation. It's a great career to look into. So I highly encourage it, especially as an easy start to become that CNA at 16 years of age already. What a great way to take a look at it. Again, so thank you everyone, and we are done.
Thanks guys.
Have a great day.